Hello everyone, my name is Muhammad Wakas Aslam. Currently, I am working in NHS. I have posted some videos regarding PLAB 2 scenarios. So today I am going to discuss about a station related to cardiac arrest. It is a SIMMAN station, and in this station, let me tell you beforehand, like whenever what they are trying to assess in this station. So let me give you a scenario. So the scenario would be the patient would be in 80 year of his age, an old man, and the patient has lung cancer, advanced lung cancer with metastasis. So what they are trying, so the patient is not breathing, so the nurse, he asks you and you have to go and assess the patient. So usually whenever the patient go into cardiac arrest, so what we have to do is start immediately. We have to see, okay, we have to confirm the whether the patient is in cardiac arrest, and then we have to start the CPR immediately. But in this station, with the scenario, there must be something that comes into our mind. So in the UK, so it is a practice that we have to assess the patient when the patient came into the hospital, that if by any chance the patient heart stop working and the patient is not breathing, whether this patient should be actively resuscitated or not. So we discussed this decision with the patient, and we made this decision. So it is very important decision which we have to take. So in this station, so what comes into our mind is the patient is of old age and the patient is having advanced lung cancer with metastasis. So I do not think that CPR is going to improve the patient outcome. So we should, as soon as the patient comes into the hospital with any complaint, so we should discuss this thing with the patient, and we should made a decision. Sometimes the patient might not agree, and the patient wants that I want to get resuscitated, and you so sometimes it is the doctor's decisions, if it is the consultant decision, he has to take, like what is beneficial for the patient, what can be done for the patient. Okay, so in this station, so they are going to assess whether we are worried about DNACPR or not. So as soon as you will enter the cubicle, there would be a nurse, and she would be saying that, doctor, I'm really worried. This patient is not breathing at all. So you said to the nurse, okay, do not worry, just let me tell me what exactly is going on. So she would be saying, this patient was admitted like 10 days ago, so he was really sick, now he's not breathing. So I tell the nurse, not worry, let me assess the patient. Now you need to go to the patient, and you will say the patient name, check the wristband, say the patient name, and the patient would not be responding. So whenever we see a patient, we see the patient may be either alert, and the patient would be responding to verbal or painful stimuli, or the patient would be unconscious at all. So in this scenario, the patient would be unconscious. So now we have to do this. We have to check whether the patient is breathing or not. So we quickly check this ABCD, like so. So what you need to do is you ask the nurse, could you please attach the monitor? In this scenario, there wouldn't be any monitor. So the nurse would say, doctor, there isn't any monitor. So quickly assess the patient. So check the airways, and place your side of the face to the patient, like assess, look and feel. So check the feel of the breath, if you can feel a breath or not. Check the pulse and see the chest expansion. So all of these things would be done in a single way. Like you are, yeah, so you are feeling, so if there is a patient, so you are feeling the pulse, you are looking at the chest expansion, you are also looking for having a feel of the breath sound. So there wouldn't be anything. So this is confirmed that the patient has gone into cardiac arrest. So now you have to say that, nurse, could you please call the emergency resuscitation team, and we need to start immediately CPR. So this is what we usually do. But you also have to say this, okay, before we proceed further, could you please tell me whether this patient has DNA CPR in place or not? Do not actively do the cardiopulmonary resuscitation. The nurse would say, yes, doctor, this patient has a DNA CPR in place. So, what will you do next? So, the next thing is you have to confirm it. So, if the nurse say that, yes, doctor, this patient has a DNA CPR in place, or you do not resuscitate, and maybe the patient, she might be confusing this with another patient, so the patient might die. So, you have to confirm it. So she would show you a document at that time, confirm and match it. And then you are going to say, okay, we should respect the patient wishes. Now we need to document the death of the patient. So you have to document the death of the patient. And while documenting the death of the patient, you have to see like, so you have to check the uh, you have to mention like pupils fixed and dilated. You have to write this thing, no corneal reflex. Then you have to say that on auscultation for 3 minutes there are not heart sounds. Then you have to write on auscultation of 3 minutes there aren't any breath sounds. You do not have to actually auscultate for 3 minutes. It's just like you have to document it like this. Okay, so uh, after these things, no palpable pulse and no respiratory efforts, and note the time and the date, mention about ECG, straight line on ECG, and after that you have to note, you have to do your signature, and you have to do the signature, you have to inform the seniors, and you have to inform the patient's family. So these are the things you have to discuss in this station. All right, cheers, bye.